Welcome to House of Tay Tay. Today we have a special guest, Dr. Natalie. Hi, Dr. Natalie.
Hi.
Please introduce yourself.
Hi, so my name's Nat. I'm a pediatric doctor, so I look after children and teenagers, and I specialize in HIV and infectious diseases.
So, how can you prevent kids from having mental disorders?
I think that's a very good question. I have to tell you first that I'm not a psychiatrist. I'm a pediatrician and I specialize in infectious diseases, but I have some experience with this because I look after a lot of kids with HIV, and a lot of them have mental health disorders. What I've learned is that a lot of the mental health disorders that teenagers have is from parenting and upbringing and stigmatization. Often, unfortunately, the people who cause the issue to start in that young person themselves also has mental health challenges. And so I think in terms of looking after young people, if you're a parent watching this, be honest with yourself and ask yourself, well, what things still trouble me in my mental health? And with the best intentions in the world, you will bring that to your parenting and your children if you don't resolve that. Looking after the mental health of the caregivers of that young person is incredibly important.
So, childhood is very important for everyone.
Absolutely.
You would say that?
Yeah. I can't remember the exact numbers, but something like 70% of all mental health disorders actually start by the time you're a teenager. And because a lot of the mental health disorders that I see in my clinic are the result of self-perception, poor negative self-perceptions. They think that there's something wrong with them and they think that they're not good enough.
So, stigma is something that we need to erase.
Yeah, and I think as an adult, you know that the reality of the world is haters are going to hate. There are always going to be people that don't like you. But I think that what we can give our young people is resilience and the understanding that what other people think of you is not as important as what you think about yourself and how you carry yourself and how you value yourself.
How do you teach kids to have these values,
I think that it's incredibly difficult, but what I try and do, like I saw some teenagers in our adolescent clinic, and clearly some of them had really suffered the social consequences of not being the same as everybody else in terms of their gender identity. I think the most important thing to me, first of all, is to normalize it, is to say, let me tell you something, you're not actually crazy. You're not crazy. You are who you are, to start listening to themselves. Because for a lot of these young people, they've gone through their entire lives with older people around them saying, you have to be this and you have to be that. And when you grow up, this is how the world works. And a lot of them are completely numb. They don't know how to listen to themselves. They don't know who they are, and they don't know what makes them happy. One of the first things that I'll say to a young person who comes to the clinic that I don't know is say, how do you define yourself? What do you identify as? I'll never say, are you a man or a woman? I'll never say any of those things. So we try and we'll say this over and over, empower them. How do we get people to feel more empowered? Get them to identify strengths that they already know that they have, and to expand on those things.
So mental health is very important for everyone.
Yeah, absolutely.
How to stay mentally healthy?
I think having a toolbox is important, and I think the basic stuff is still important. Things like getting enough exercise, getting nutritional food, getting good
Enough
quality
sleep.
sleep. Yeah. The really basic stuff. I mean, it sounds stupid and basic, but it's important. And the other things is surrounding yourself with people who believe in you. If people don't believe in you and your potential, then you're never going to believe in yourself if you don't already. I think helping our young people to navigate healthy relationships is incredibly important, especially if they've been through an upbringing where they don't understand what a healthy relationship is.
It's hard, everything comes from the family, actually.
Yeah.
It starts from the household. And for parents to do better, they need to understand what the kids really want in their lives and what do the kids want.
I think what kids want is actually a human thing. It's what adults want. They just want to be happy. They want to love others. They want to be loved. And they want their lives to be meaningful and stable and safe. I think those are very basic human desires.
Yeah, so basic human desires are actually the necessity for kids.
Absolutely. I think the reality is it's not possible for a young person to have access to all of those things. And so we try and work with what we have. We try and keep it real, because I think the difficulty of what a lot of young people suffer with is, oh, the books tell me this, and ideally it should be 1, 2, 3, but I don't even have the first thing, but I'm supposed to be doing 10 things. How the heck do I start? And so we try and work with what we have and just grow from there.
So describe therapy that adults can do mentally.
Yeah, absolutely. I mean, there are many options. Some people find going to a psychiatrist helps. Some people find that group therapy helps. Some people find that talk therapy, going to see a clinical psychologist. And some people actually go through quite a few options before they find what works for them, or even what therapist works for them. Even like 2 days ago, I saw a young person who said, oh, doc, I've seen a clinical psychologist. It really didn't work with this person. She wasn't listening to me, but I spoke to this person and it changed my life.
You never know.
Yeah, so expect
Just
to spend some time
out,
exactly exploring
who you click with.
Yeah, exploring what works for you, and never assume that what works for somebody else is going to work for you. You have to figure out what works for you.
Yeah. What would you say about mental health facilities in Thailand? Has it been improving? This is a hard question. Around 6 years ago, when I started my recovery, I couldn't find many tools. I had to buy books from abroad. I had to find therapists from like very expensive hospitals. There were not many available resources, Has it changed?
From what I know, things are slowly getting better. Mental health is more talked about in medical professional circles, but I would say that it is moving very slowly. And if you're sitting watching this and say, yeah, doc, but I have a problem now. What do I need to do now? And what I would say to you is try and find online resources that are helpful. So there are definitely channels, pages that I know that exist online that can at least help give you an insight as to what's going on in your mind and practical steps that you can take to make things better. Certainly in our clinic, we try and do our best to provide mental health support for people who want it and need it.
Do you think Thai way of parenting have effects on kids mentally?
I think there is a good side and I think there's a bad side to everything. I think that the great side about the Thai way of doing things, when it works well, is that it's a very collectivistic community. So for example, when I was practicing in the UK, I would frequently see kids that had been abused by people who were using drugs and alcohol. And the kids came in, with very clear physical scars of abuse. Of course, we're talking about mental health, and the mental health scars you can't see, but they're there. But I think that when parents themselves are traumatized and have mental health issues, and they take that out on children, regardless of you're in the West or you're in Thailand, I think the results are the same. It's you get a traumatized child that then becomes a traumatized teenager and a traumatized adult, and then the cycle goes around.
Yeah. So the concept of tiger parenting, what do you think of it? Because I had a tiger parent.
Yeah, I have to say I had the same. The intentions are probably good, but the results speak for themselves in all of the therapy clinics that you see and all of the mental health issues.
You see people finally getting therapy in their adulthood,
Yes. It's down to culture and people who don't understand the harm that they can cause
mentally.
Yes, to people.
Because they don't see it.
Yeah.
It's not visible.
The other thing that I would say also is that the people who perpetrate the harm also themselves, I think, don't have the mental health awareness or skills to manage their own mental health. And that's why it floods and spills over to their children of the expectations.
It's been carrying ancestral, through ancestors,
Yeah, absolutely. And I think these things are there's this thing called intergenerational trauma. And a lot of tiger parenting, I think, is about.
I'm doing this channel to break it. I want people to have more understanding about the ways they live their life and, empower them to be themselves and not having the trauma that they were facing when they were younger, but to overcome it and become a better self.
I think it's amazing. I think that's amazing. And, I really applaud you for doing this.
Thank you. How do you see the future of Thai kids?
I think it's dependent on so many factors, but I think the most important thing is what we are exposing them to, both the things that will harm them and the things that will make them resilient. And I think it's a combination of those two factors that will influence what we get in the end. So I know I haven't really answered your question, and I think it's because I don't really know. I don't know what's going to happen. But my hope is that when young people have access to more online information that's not fake news and it's accurate, that they will be empowered to look after themselves regardless of their personal social circumstances.
Thank you so much, Dr. Natalie. See you again.
Bye.
Bye.
Bye. Thanks for having me. If you like this content, comment, like, and subscribe to Taylor C Lab.